Hello and welcome. It's 2 o'clock on this lovely afternoon of Friday, April the 10th. And if you're here for part two of the Mind Matters series, you're in the right place. We are so glad you're here today and welcome your participation in today's event. Please use the chat feature to submit questions or comments. These are monitored throughout the program and will be addressed by the moderator at the appropriate time. If you prefer to speak, please click the raise hand icon. The moderator will invite you to unmute when it's your turn. An important note is that this webinar is being recorded. By participating, you consent to be included in this recording. Should you prefer not to be recorded, please use the chat feature only. Now it's time to dive in. Please welcome Dr. Sood to get us started today.
Thank you, Janice, and hello, everyone. My name is Anupha, and I lead the Total Care Program for Parkinson's disease here at UT Southwestern. Welcome all to our second event of the series titled Mind Matters. We are organizing this series in partnership with DFW Parkinson's Resource, which is an online resource hub for Dallas-Fort Worth Parkinson's community. And before I launch into introducing you to the founder, Shelley Kurian, and to Dr. McDaniels, I do want to mention our symposium that's coming up, which will also include the third event of this series in the afternoon. I am going to send you all the agenda here in chat in a while. So please do register for our third event that'll be coming up April 25th. And with that, I'm going to pass it on to Shelley to talk a little bit about her organization and introduce herself. Thank you.
Thank you, Anuba. Hi, everybody. Good afternoon. It's great to be here with you all. As Anuba mentioned, my name is Shelley Kurian, founder of DFW Parkinson's Resource. We are an online resource hub, and our mission is to connect those affected by Parkinson's disease with local resources so that they can be informed, confident, and empowered to thrive. We know it can be challenging to navigate all of the existing support out there in the community, and so our goal was to consolidate all of that information into one easy spot for you guys to see what's out there and see what kind of help you need. And of course, we are available as needed as well to help guide you through that. And if there are any resources that you're looking for are not available on the hub, we're always available to assist you with that as well. Brad McDaniels is our facilitator for today, and I'm excited to introduce you guys to him. He's on our board at DFW Parkinson's Resource, and he also serves as the Associate Chair and Associate Professor at the Department of Rehabilitation and Health Services at the University of North Texas, trained in rehab counseling at the University of Kentucky with postdoctoral work at Virginia Commonwealth University. He focuses on holistic wellness in Parkinson's disease and has a commitment shaped by his mother's diagnosis and serves on multiple Parkinson's advisory boards. So, Brad, we're excited to hear from you today.
Thank you, Shelley. I appreciate it. Let's make sure I get this working before you disappear.
Okay. There we go.
Let me get it in slide mode. All right, you seeing the full slide, or are you seeing presenter mode?
Nope, we're seeing the full slide. Looks
beautiful.
Great.
All right, I was able to do it. That's impressive. Well, thanks again for having me back. I'm excited to be here. I guess I looked at the the attendees, and it's such a nice day. We were talking before we got on here. I wasn't sure anybody would come with spring-like weather in Texas this time of year, but appreciate you being here, and hopefully you'll find something valuable in this talk today. So, as we've gone through this process and thought about what these talks should look like, we kind of rested on this second one about connection and belonging in Parkinson's, and what are the challenges there? And from my perspective, it's always more important than identifying the challenge is identifying what the solution is, right? I think that we all want to know what can we do to make our lives a little bit better. And so that's kind of how I set this up today, and you'll kind of see as we go through. I like this quote at the bottom. Belonging is not a luxury, it's a part of health, coping, and quality of life. And that was from the Surgeon General shortly after COVID. There was data on loneliness and social connection pre-COVID, but not nearly like what we have today. After COVID happened, we had everything. Health issues went south, depression went up, anxiety went up, divorce went up. We had all of these social issues that happened. And so we started looking into this, what role loneliness played. And so there's been a burgeoning research that's happened as a result. So we're going to talk a little bit about that today, excuse me, and a few other things. So for those of you who were here before, I've got a couple of questions that I'll ask throughout this talk. I've got 3 of them. So if you've got your phone, you can open up your camera and scan that QR code on the right, and you'll get a little yellow box underneath it. You click on that, and it'll take you to iClicker, or you can log on with the URL on the left there and get into the site where we'll do the surveys, and you can do it right from your phone. These questions are very simple and straightforward. So I'll give you just a second to do that, and then we'll get going. All right, here we go. So I'm just going to give you a little overview of what we're going to talk about today. Of course, just like before, this is geared towards largely to people with Parkinson's and their care partners. I didn't see clinicians on today, but some of these things are applicable to them as well. And my hope is that there's something that you can leave here with today that you can put into practice immediately. It'll make a difference. So we're going to talk about the social barriers that are created from Parkinson's, and talking about what helps with communication and getting into a group and different activities, and care partners. There are a couple of slides that I'm going to talk specifically to care partners, because I think that I mentioned it last time that the care partner group is largely neglected when it comes to Parkinson's disease. And it's a critically important group that I think we need to talk about, right? Because if care partners aren't good, the person with Parkinson's disease may not be good also. So we're going to talk about that, and then we'll talk a little bit about a connection plan at the end. So that's a little overview of what we're going to do. So I thought we'd talk about a few terms up front that I think get muddled when we in the media and what we read. And so social connection is this idea of having quality relationships with other people. Do I fit? Do I have a tribe, if you will, that I am connected with and that I do life with? So that's different from the social isolation piece, right? It's really the opposite, that social isolation is the objective state of being alone, right? So I think the confusion often comes in talking about loneliness and social isolation, that someone can be socially isolated, right? Like right now, I'm in my office by myself, I'm socially isolated, but yet I don't feel alone. I feel like I have a connection with people, and so that can happen. The opposite is also true. Someone here may have experienced walking into a room filled with people, so you're not socially isolated, right? There are people around you, yet you feel alone. And so loneliness is really that disconnection, that gap between the connection that I want and the connection that I have, right? So if I want a lot of connection with other people and I only have a little, I likely feel lonely. And so those are the words that are important, I think, to set the framework for the stuff we're going to talk about. And what we know is there is a very strong relationship between health outcomes and social connection. People who are connected to other people do better. They have less depression, they have less anxiety, they have apathy is one that's kind of different, but at any rate, most outcomes are better for people that are connected. And that's not just Parkinson's disease, that's across chronic health conditions in general. Even people who don't have a chronic health condition, right? We function better when we are connected. And it's thinking about what are the roles that we have when we connect, right? That that you all have in your lives. You have maybe have a spouse or a son or a daughter, or you're an employee, or you're a friend, right? Those are the ways that we often connect with other people. And it's important as to consider that as disease progresses, as Parkinson's gets worse, whether you are the person with Parkinson's or their care partner, that sometimes those roles go away, right? That we may have to change some of those valued roles. Let's say, for example, as an employee, someone has been working for many years in a field, and as a result of some of the challenges associated with Parkinson's disease, they may need to step away from their work. And oftentimes that's a major source of social connection. And so when that role changes, social connection can also drop. And so it's trying to figure out, how do we maintain some of this connection despite role changes? And I think the other piece that's important is anytime we feel like we belong, symptoms can improve, even though they don't go away, right? Let's say I have clinical depression and I feel like I belong. The outcome of that depression may not be as bad because I've got people around me who understand, whom I connect with, and who care about me, right? So I hopefully I set the stage for basically what we're going to talk about today. Now we're going to get into a little bit of what the Parkinson's disease research says. And some of this data was done by my colleague, Indu Subramanian. We've written a little bit about this stuff. She did a study with Laura Mishley back in 2022, I think, looking at loneliness. And what she found, or what they found in their study, was that 55% symptoms increased by 55% for people who were lonely. Motor symptoms in Parkinson's, right? So tremor got worse, gait got worse, and even the non-motor symptoms, depression, anxiety, other things. And so this was just the data we had before. This wasn't specific in Parkinson's disease, but now we've got data looking at that, and also found that people who had friends had 21% fewer symptoms in the same study. So we also saw quality of life improving, right? People who are connected tend to report better quality of life. And I think most of the time that's what we are after, right? Is we want to feel better. And oftentimes controlling the symptoms in Parkinson's disease, tremor, gait abnormality, slowness, isn't the thing that makes us feel better, right? It's the other things. And we've talked about this before with non-motor features and things like loneliness that can really help us feel like we're part of a community and that we can actually participate with other people in life. And so anytime we have social withdrawal and we have communication challenges and we lack support, symptoms are going to be worse. And most of the time we're going to report poor quality of life. So then the question becomes, what do we do about that, right? We're going to get to that in a second. But what is it in Parkinson's disease that can make social life, social connection, engagement more difficult, right? It's a disease that affects every part of your body, right? Mind, body, spirit. And we all very familiar with the motor challenges of Parkinson's disease, right? Those can really go without saying, as I kind of preach to the choir here about PD. But those things, as the disease progresses, get worse, right? We can do a decent job of treating those symptoms, but they still can remain problematic over time. One of the other issues that we begin to see are vocal changes, right? How loudly someone talks. Oftentimes it's not uncommon that I've heard someone say goes to a doctor's office to see their movement disorder specialist, and the person with Parkinson's says that my spouse is losing their hearing because they don't hear me, right? And which may or may not be true, but oftentimes it's the voice is lowering so other people aren't hearing. So that can be troublesome. And even the facial expressions, right? The facial masking that is common with Parkinson's disease can be misconstrued as other things. So those things can affect social connection. Then, of course, depression, anxiety, apathy, those any of those mental health conditions can make it much more difficult for us to want to get out and engage. It's interesting, right? Because the one thing that can help depression is activity. And it's one of the hardest things for people to do when they're depressed, right? Is we want to just kind of hunker down, stay home, and not engage because I don't feel like engaging. And so it can be difficult to encourage someone to, even though you don't feel this way, to engage. And then, of course, cognitive challenges that are common, word finding issues, short-term memory issues, that it's hard sometimes to follow conversations. I see that with my mom when I have conversations with her, that she repeats herself frequently, and maybe doesn't necessarily follow something that I'm saying to her. And then again, that can affect relationships with other people because we become self-conscious of those types of things. Leads right into the next box I've got there of stigma. We wrote a paper on stigma a couple of years ago and how prevalent stigma is with people with Parkinson's disease, right? And the fear that comes from maybe not being able to understand, not being able to articulate what you think, and something that can lead to avoidance. And then just the simple logistics that happen around chronic illness. Maybe I want to engage and I want to go to a Parkinson's disease support group, but I have no way of getting there, right? We need to consider those. And I'm going to talk a little bit more about that in a few minutes, but this kind of sets the stage for, I think, things that, again, you all know, but it's so broad, all of these things that impact our ability or desire to connect with other people. So I think one of the biggest challenges are these hidden barriers, right? People can see if you have a tremor. People can see if you have a gait abnormality. And oftentimes they might be able to understand what that is or have some type of attribution for what's going on. But what people, I think, in the general community struggle with are things like the facial masking, right? Because oftentimes it can look like someone is disinterested, like they don't care, like they don't have any emotion, like they don't want to engage. And even there's literature that talks about physicians judging patients with Parkinson's disease as not really paying attention to them when they're in the clinic because they're viewing facial expressions and social cues. And those things are really difficult because I think, if we interact with someone who has Parkinson's, right, and we don't understand that, we're going to begin drawing conclusions in our mind about that person. And then we may withdraw, which makes them feel like they're being judged, less valued. And then it may lead to pulling back and not choosing to engage in social settings because it becomes uncomfortable and it becomes something that you just don't want to have to experience that all the time, and having to always explain um, something that's going on in your life, my facial expressions, or the fact that I talk slowly, or the fact that I ask you to repeat what you said so that I'm clear about that. um, that can be tiring, right? Having to always do that. And so these are some of the things I think that are more, from at least what I hear, and I think the literature is pretty clear, that are the problematic issues when it comes to stigma and Parkinson's. So, these are the visible and the invisible. This slide I've kind of talked about, and I don't really need to spend much time here. But I think that, one thing that's interesting, and we talked about it in our paper, are things like someone who has a gait abnormality, shuffling their feet, walking slowly, could be seen as being intoxicated, right? We've seen reports of that. And so again, that creates this feeling of I don't want to be judged. I can't really change that symptom. And so I don't choose to participate anymore. Fatigue is another big one that challenges whether or not we want to engage with other people, right? And then even, someone who doesn't have visible symptoms of Parkinson's disease, but the invisible symptoms are affecting the way that they interact with other people. And the quote that I have there, right, is like someone can see you and say, well, you don't look sick. You seem okay. And because they don't see the stuff that's going on inside and underneath that can really affect our desire and ability to engage socially. So the data on stigma says that about 50% of people with Parkinson's have experienced stigma in their lives. So that leads me to this first question that I'm going to ask, and let me get this set up. We're just going to do short answer and go. Oh, crud. It's not working. Don't tell me that.
It's working on my end. I scanned the
Okay.
QR
You can see the question?
and it's on the screen, and the link has been dropped in the chat as well for those that didn't
Okay.
do.
It's not on my screen, but I'm glad it is. So
Yep.
there we go. So if you can respond to that, we'll see. Be interesting to see how this data compares with what we see in the published data. So far, 71% have experienced it, right? Not surprising. Still saying right pretty close to that. Yeah, as a partner, exactly. And we're going to talk about that too in just a minute. Care partner experiencing the same stuff. So yeah, we're pretty close to what the literature talks about is 50% at least have experienced it. And so I was just always interested to see how close we are to what the literature is telling us. So yeah, 70%. So thanks for participating in that. We'll have another one here shortly. Let me get this out of the way. Next slide. So that kind of brings us to this, that, stigma, the biggest challenge with stigma is my belief about being judged, right? Oftentimes, I may not actually be being judged by someone, but my perception is that I am, sorry. And that's what creates the problems. And it's this anticipation, right? And that's what fuels my desire to not want to engage, because my assumption is if I go and engage in this setting, people will judge me and they'll treat me differently. And your experience may support that, but confirmation bias happens, that I'm probably going to be able to find the situations in my life, in my social setting, that support the fact that I'm being judged harshly. And so it's kind of we get what we look for with that. And there's the stat on more than half of the people, but self-stigma is highly correlated with poor quality of life. So the worse I feel about how others are going to treat me, the lower my quality of life is going to be. And so one of the things we can do with stigma is, the biggest area that needs to change with stigma is just education, understanding Parkinson's disease, right? Because for many years, we've had the picture of Parkinson's disease of the old guy with the walker bent over and saying, this is Parkinson's disease. But you take younger people who are diagnosed who don't look like that picture, and the assumption can be, well, you can't have Parkinson's because that's not what Parkinson's is, right? And it was probably my assumption before I understood anything about Parkinson's, before my mom was diagnosed, right? I thought that it was a disease of older people. And that's largely true when you look at percentages, right? Less than 10% of the people are diagnosed before the age of 50. So it's odd when you think about seeing somebody younger. And so that's one of the biggest things that I think we can do as a Parkinson's community. And we're slowly moving in that direction. Michael J. Fox and his organization have really opened the door on young onset Parkinson's disease, at least with him being the face diagnosed some 30 years ago, I think, at this point, to see that Parkinson's disease is not just a disease of older people. And the other thing I think that we can do, that can be done, to help with stigma is to have statements that you can say. I may look flat, but I am engaged. If you're slow to respond to something someone says, you might just say, "Hey, give me a second before I respond. I'm not following what you're saying, or I just need a second to get my thoughts together." And the other thing that's valuable is having a list of things that you want to talk about with your doctor, right? That prevents the issue of sitting in front of your movement disorder specialist and they say, "How have you been since in the last 6 months since I saw you last?" And maybe you're self-conscious, you're anxious, and you might feel like my thinking is not clear. I can't spit out what I'm trying to say to him and the things that I need to share. And so having a list of things that you want to talk about, and I say that rank ordering them is good. This is the most important issue that I need to address today so that we can make sure we get those things handled while we're there. And the other thing is, I think oftentimes this self-blame is this idea of I'm not good, I can't do that, I don't communicate well, I'm too slow, right? It's all of this self-talk that we can easily fall into that perpetuates this feeling of being judged, not being able to, feeling like you're not able to engage in the activities that you used to engage in. So sometimes it's just reframing our thoughts that it's not that I can't, it's maybe right now is not the right time to engage. Maybe thinking about when I'm going to engage, whether it's on time or off time, right? Thinking about if I'm off my meds right now, I'm at the low point, maybe that's not the time for me to go to engage because my symptoms are going to be worse. And then I'm going to perceive more stigma. There may be more judgment. But so sometimes it's just thinking about those things ahead of time before we engage more fully. Why is this not working? Lost my thing here. Something stuck. Sorry, bear with me here. My screen is, there it goes. I don't know what was going on. So I talked at the beginning that I was also going to talk about care partners because what I know is I teach my counseling students all the time. You can't pour from an empty cup, right? So as a care partner, you have been tasked with helping your loved one who has Parkinson's disease. And that requires a lot, right? There's a lot of things that go into that and things that you're probably learning that you didn't realize were part of your job. And if you're not taking care of yourself and you're not socially engaged in doing things that are important to you, it's going to affect your mental health and it's going to affect your quality of life. Therefore, it's also going to affect your loved one. So one of the reasons, or several of the reasons that this happens is your role has changed, right? You may have been a spouse before, and your role was to take care of your loved one. Let's just say that's the role. And all of a sudden now, or to love your partner, and all of a sudden now, they have Parkinson's, and that role has dramatically changed. I'm having to do things that I didn't do before, having maybe to take care of scheduling appointments and getting them from point A to point B. And it can be tiring, right? And even in the relationship that might change, the spontaneity of a relationship, the intimacy. And when I say intimacy, we're not just talking about sex, right? We're talking about this emotional connection that we can have that can be challenged whenever I feel really tired. I begin to feel depressed and I'm just not socially engaged and I want to withdraw. And then the opposite can happen when I begin to feel like I need a break, respite. I need to go out with some friends. And then I feel guilty because I want to do that, because I'm leaving my loved one at home. And that can also create a lot of challenges. And then even feeling, we talked about feeling isolated when you're with other people. But because I think of the mindset that happens with a care partner, and you're constantly feeling like, what do I need to do? What do they need from me? And you're so focused on their needs that you don't take care of your own needs. And then I feel alone and disconnected. And then my relationship at home with my loved one can be challenged. And what we see is the care partner burden for people with Parkinson's disease is fairly high, higher than in some other diseases. We see it more. People who have TBI and spinal cord injuries, their care partner burden is higher than what we see with this. Even stroke, post-stroke, for people who've had severe stroke is higher. But for Parkinson's disease in general, it's mild to moderate. And it's clear why. We kind of talked about those things, but so many things now that you weren't having to take care of that all of a sudden you are. And then we've had all of these changes that have happened. Maybe there are financial changes that one of you was the primary breadwinner and now that's gone. And now all of a sudden we don't have the social connections that we used to have as a result of Parkinson's disease. There's depression that begins to happen. And all of those things add up, right? They're cumulative over time. And so I think it's the little changes, and all of a sudden it becomes this mounting burden. It is like, wow, I didn't realize how challenging this was. And then I think it's understanding the need that care partners have. Care partners need to connect just as much as the person with Parkinson's does, right? They need their tribe. They need a support group. They need friends whom they can connect with and have conversations that maybe aren't formed around Parkinson's disease, right? Because that becomes your life, right? And so it doesn't mean that when you need that time for yourself, that you're abandoning your loved one. It just means that you're taking care of you. And I think it's important to hear that and to have that be normalized, that it's okay to need to take care of yourself so that you are the best that you can be for your loved one. So what happens in this loneliness cycle that we can get into is got these symptoms and they begin to change over time. Motor changes, I'm fatigued, cognitive changes, and all of a sudden I begin to interact with other people and maybe I feel like I'm being judged, or I just begin to think every time I go out, there's going to be someone who doesn't understand me or looks at me funny or asks me a question about, am I okay? So then as a result of that, I begin to pull back. I begin to think, I'm just not going to go out anymore. I don't want to have to deal with those feelings that come from that. I maybe don't reach out to friends because when I'm on the phone, they have a hard time hearing me because my voice is so soft. Or I I maybe am slow. They say something and I'm slower in processing what they say. And they say, "Are you listening? Did you hear what I said?" And that can be frustrating, right? And so again, as a result, you go to the bottom left-hand corner and then loneliness increases. So as my symptoms get worse, stigma can happen, the beliefs about that. Then I tend to not want to engage. I feel lonely. And we saw in some of the previous slides, when we're lonely, symptoms get worse. So symptoms get worse, and then the misunderstanding gets worse. Then I withdraw even more, right? So you can see how this cycle just continues to happen. And the only way, one of the main ways, I shouldn't say the only way, one of the main ways to counteract that is to have some people whom you're connected to, right? I call it your tribe, right? Who are the people that you can count on? Who are the people that understand you? Who are the people that you feel comfortable with? If you don't have that, I encourage you to try to find it, right? There are a lot of group things that we have going on in the DFW area with the different organizations around town where you can find connection and you can find other people who have Parkinson's or have a loved one who has Parkinson's who can have a conversation with you and understand the challenges that you're facing and the struggles that you have and why you feel alone. So try to connect if you're not. Talk about that in a second. So the thing that comes up often is loneliness something I need to be really concerned about? The answer is yes, from a clinical perspective, right? That we know that loneliness makes things worse. And we just saw the cycle on the last slide that symptoms get worse, withdrawal happens, loneliness gets worse. And so it is an issue that we need to consider. But is it an issue that we need to be overly concerned about from a safety aspect, if you will? So it's not uncommon for someone to need a break, to step back. Life's busy. I'm just tired. You know, that's really, to me, that's more of a social disconnection or social isolation more than it's just loneliness, but it could be both, right? And so when that happens, that's not a concern. I think that's a normal response to stress in life. Sometimes I just need to take a break. But then the next level is this amber level where you begin to have your sleep disrupted. You're not enjoying the things that you used to do. You don't feel like you're a part of a group. You don't feel like you're included in activities that are going on. And as a care partner, you begin to feel overwhelmed. You begin to get to this place of burnout, right? Where you just can't continue to function the way that you have. And so you choose to isolate, which can lead to loneliness. And that's something that is, as you begin to see some of those symptoms, you might say, you know what, I need to work on re-engaging and finding that group of people whom I can connect with. And then when it becomes concerning is when we have evidence of major depression, right? There's an association there that, major depression is a diagnosable condition. And if someone has the symptoms of that, there would need to be some discussion with a professional. And talking about it with your movement disorder specialist is important. I think so often, from my experience, what I've seen with my mom and just in conversations with other people, is oftentimes the conversations are so focused on movement, right? As they should be. Parkinson's disease is a movement disorder. I think we're seeing more and more data come out, and more people talk about the fact that it's a holistic condition, and it may even be considered a neuropsychiatric disorder because of all of the cognitive and mental health challenges associated with it. So I think it's important that you share these things with your movement disorder specialist. After you do the testing that you do in the office, talk about, I'm struggling with feeling down. I don't have any hope anymore. I feel helpless. It's another paper that we wrote late last year on demoralization, this hopeless, helpless meaninglessness. Life has just lost its zest. And, all of that can lead to feeling unlovable and worthless, which in turn can lead to having suicidal ideation, which is obviously something that's very concerning. So, as a care partner or as a person with Parkinson's, if you see your loved one exhibiting some of these symptoms, it's important to talk about them. Bring them out, ask questions, and get help if needed, because they're treatable, right? And so it's important that we have someone in our lives who's helping us navigate this and be able to talk about it. Another poll. Who is that person in your life that you are most connected with? Here we go. You can just name them: spouse, son, daughter. You can name the person's name. Who is that person? Hmm. In spouse, half the people have spouse. Yeah, friend, sister. Let's see this. Do the word cloud. Yeah, sister, friend, brother, spouse. Spouse is clearly the winner of the bunch. 50% of people say spouse. The reason I ask that question is it's important to think about who my go-to person is if I have something that I need to talk about. And being able to name that person so that I know who to go to and I know who to connect with is critical. So I've spent the first half of this talking about the problem of loneliness, the problem of social isolation, how stigma can impact that. And so now we'll talk a little bit about the so what, right? What do we do about it? And I think this is a challenging part here where we talk about support groups, right? Because I know that there are a wide variety of opinions on support groups. I think the reason that I think they're one of the reasons I think that they're valuable is it's a group of people who understand the condition that you're dealing with. That being said, I think it's always important to match the disease stage with your disease stage, right? And I've heard this from a lot of folks with young onset is they go to a support group and everyone there is in their 70s and 80s, a different stage of life, experiencing different challenges. Maybe none of them have kids at home anymore, but I'm 35 and I've got two young kids and I'm trying to hold down a job, right? So it can be seen as really difficult for me to connect and find a way to engage with that group. So try to find a group that fits your your dynamic, what's going on with you. I think these groups can help with normalizing symptoms, right? I'm feeling this way. Is that normal? A spouse may not be able to tell you that. A friend may not be able to tell you that. But if you go to a support group, you might hear, yeah, that's a normal part of Parkinson's disease, right? I'm struggling with not wanting to do anything. Is that normal? Yeah, apathy is a significant issue with Parkinson's disease, right? And anytime that we can normalize the challenges that we face, they become less troublesome, right? So oftentimes it's just as simple as saying it's okay and that's normal. And learning practical tips, learning things that other people have already done to help them through their problems. I heard a quote years ago from a guy named John MacArthur, and he says, experience is the best teacher, but it doesn't have to be my experience, right? So I can learn from you. If you tell me what you went through and how you handled it, I can begin to implement that maybe without having to go down a negative road to deal with a problem. I can use what you shared with me to help me feel better or deal with that challenge. And again, it creates routine and it creates expectation. You become involved in a group of other people and you show up on a regular basis and all of a sudden you're not there and people go, huh, where's Brad? Wonder what's going on with him. And you get a phone call. Hey, we haven't seen you in a couple of weeks at group. How you doing? Right? You feel welcome. You feel cared for. You feel valued. You feel like you belong. And so I think that really helps with this connection. And understanding the format, there are so many different types of groups now. Again, post-COVID, we've had this spawning of online groups. And there are a lot of those that you can get involved in, like this today, right? Everybody's joining in an online format. And understanding is online what you like, or is it not? And trying to find a group that fits what your needs are. And there are challenges with online groups depending on where you live. You might not have good internet connection, things like that. So it's important to think about that. And what's the focus of the group? Is it just a social group that allows me to connect with other people and engage? That's great, right? There's a lot of value in that. Is it an educational group that someone who is an expert on Parkinson's disease or some aspect of Parkinson's disease comes and shares about that? Is it just emotional support? Exercise group, right? We have all of these different groups that are available and can be engaged with. And so I think it's finding that group for you. And we talked a little bit about off times earlier. It's thinking about the time of day that a group meets. My best time might not be at 6 o'clock at night, right? I may need to find a group that meets at 2 in the afternoon because that's my best time. I'm less fatigued, able to do that. Thinking about how you're going to get there. Is it accessible? Right? Is there someone I can get a ride from if I need a ride? Can I get there? Can my loved one get me there? And Then I think the last one is, do I feel like this group fits? Do I feel a connection with this group? And here's the thing. If you find a group that you go to and you're not connecting, maybe try another group, right? So often it happens that, you may hear, well, I've tried groups and they don't work for me. And, you tried one group and it wasn't effective. And I think an interesting take to that is the question of asking someone, so was there ever a time in your life where you were dating someone and that relationship broke up and it didn't work out? Everyone's going to respond yes to that, right? And the follow-up is, so did you quit trying to have relationships? Right? Most of us moved on. We maybe had a bad experience in a relationship, yet we took that under advisement and we moved on. So I think the same attitude can be taken with a support group of, this one just didn't work for me. It doesn't mean support groups don't work. It just means this one was a poor fit. Find one that works. And I think that you can see the value in what that would bring to you. Here we go. So we talked a little bit about this whole digital connection thing, and it's great. It's really resolved a lot of issues. It allowed us to be able to connect across broad geography and different time zones, things of that nature. But there can be some challenges. Um, Being able to use the computer. It's one of the things that my mom struggles with, is being able to get online and get on a Zoom and all of that. So the technology burden can be a factor. Just having low confidence in my ability to do that. Medication side effects and timing can also interfere with whether or not I engage in these groups. But I think having simple tools like this meeting today, a simple link that can be clicked on that you can get there very easily. You don't have to have a lot of technological savvy to engage is important. Having someone in an online group that can serve as a moderator. I think that helps prevent just having people connect and kind of having not being sure where this group's going to go. We have a reason that we're here and we have something we're going to talk about. And then oftentimes maybe having a hybrid option could work where some people are in person and some people are online. Everybody wants something a little bit different, but I think now that we have so much access to technology that it really gives everybody an opportunity to connect in one way or another. So what helps? Part two. One of the things that I'm asked frequently if I'm talking about apathy is, what do I do when my care partner has apathy and they don't want to engage? And I think one of the best tools that we can use is to engage together, right? Rather than you should go exercise, you should get up and go for a walk. Just change the way I say that to, hey, let's go to the gym. Let's go to boxing class. Let's go for a walk, right? Getting together and doing it together can begin to, it helps with the loneliness issue, right? Because you're doing this with somebody else. I've got this social connection and it helps the motivational piece. It helps me with, hey, this can be something we can actually begin doing together. And as the care partner, I don't have to feel like I'm nagging all the time to, you should be doing, let's do. And, there are things that you can do together. Take educational classes and learn about something new, whether it's an art class, something for fun. Engage together, and it kills two birds with one stone, right? You're moving, you're getting out, but you're also having this connection. And you don't have the need for this, what I call here is activation energy, thinking about how am I going to engage, right? Activation energy is about making this plan for what I'm going to do next. When I've got a connection with my loved one, my care partner, it takes that stress of, how am I going to connect with, hey, I know every day at 10 o'clock, we're going to go to the gym. Every day at 10 o'clock, we're going to go take a walk, whatever that may be. Have a schedule and have a plan for what that's going to do and do it together. that can create, helps with the intimacy issues and just the lack of connection and stress. Another thing I think that is often overlooked is we talk about communication problems with Parkinson's disease. But, the other piece of that is most of the time when we talk about it, we're talking about it from a voice perspective, right? The motor challenges. My voice is low, my voice is soft. And those are the things that we really spend time on with Big and Loud LSVT, right? Training on how to project and be louder. But I think the other thing that is a challenge is how we communicate. What's our communication style? There are a lot of things that impact that. And one of the things that literature shows is that when we have positive communication with someone, our cortisol levels decrease, which, cortisol is the stress hormone. So a better communication and better connections, cortisol releases and oxytocin goes up. Oxytocin is that hormone that makes you feel good, right? So it's a double win, right? I'm feeling better from one hormone and I'm not feeling as bad from the other hormone. So it's important to figure out how can we best connect. And I'm really gearing this right here towards you and your care partner, because I think that's where many of the communication challenges happen, that we're sitting at home, we're having a conversation, and it's maybe not going well. Um, I didn't hear what you said exactly because the TV was on, right? I'm scrolling on my phone and you're talking and I'm not listening. So it's beginning to think about things that interrupt my ability to connect to what's actually being said and what the conversation is going on. So, asking questions along the way, like, did what I say make sense? Does that follow with our conversation that we've been having? Did I hear you correctly? Right? Learning how to use some of these communication tools to help connect is critically important. And also with having the way that I connect in clinic visits, because if we're not connecting well at home, then it's going to be really difficult to share some of these things when we're in a clinic. And there's something I need to share. Maybe I'm the care partner. I know you're struggling with this, but I'm reticent to share that because we haven't had the conversation about it, and I don't want to make you feel like you don't have the autonomy. And so thinking about those things, as far as communication goes, is really important. Gosh, this is just not working well. So on that note, who is one person in your life whom you've lost contact with over the years that you would like to reestablish connection with? You think of who that might be? Oh, I didn't stop the last one. Let me restart this one. Sorry about that. All right. One person that you lost contact with whom you'd like to reestablish connection with. Who might that be? Pop in a word there. Old friend, sure. Parent, yeah. Friends. Yeah, I think we all have, right? Maybe it's that one person that comes to mind when you think of that question. Maybe you've had to think about it, but you'll see why I asked that question in a second. But think about who it is in your life that you would like to reestablish connection with. What else do we have down here? Daughter, friends, several friends, right? Too many to name. I can relate, right? So we've all got those people in our lives that we think about from time to time. I haven't talked to Jim in a long time. I wonder how he's doing. Or if another friend that you're friends with asks you about that person and you haven't connected in a long time. So thinking about who that person is. Gosh, this is just not smooth today. So as we think about what to do moving forward, right? So we've talked about the importance of social connection, and I hope I've made the point really clear that loneliness and social connection are important issues for all of us, but particularly for people with Parkinson's disease. And we need to have strategies to deal with those things. And one of the things that we've written about a little bit is this idea of social prescribing. And I think it's a great idea. I don't think it's been well defined yet. What we've talked about is having a clinician just give a patient a prescription for going to a support group, going to an exercise group, engaging with other people, right? But I think the piece that we missed is it's easy to do that, but you may not consider the barriers that are getting in the way of that. Someone who's unable to get to a support group, someone who can't get in an online support group because they live in a rural area with poor internet connection, right? So we're still trying to tease that out. But here are some things that are, I think, doable right away. And so choose one person who feels safest and easiest to reach out to right now. Maybe who's that person that you just listed on that previous poll? Reach out to them. And if it's not that person, reach out to someone else in your phone and choose a place to meet with them. Whether it's a phone call, whether you go have coffee, whether you go have lunch, pick that in the next week and set up a time. Then help it become routine, right? Maybe meeting on a weekly basis is too much. Maybe it's a phone call each week, and then every other week we have coffee, right? You know what your schedule is and you know what works for you, but begin to make a routine about that, right? To where it's set, that it's kind of part of my schedule, that I'm going to meet with Jim every Thursday. We're going to have a phone call at 10 o'clock in the morning just to touch base, see how each other's doing, talk about life. And then think about what would make the connection easier. Maybe you got to ask for, you're at dinner and you need a quieter table, right? It's learning to recognize what the need is. I need a quieter space so that we can talk. I need you as the person I'm engaging with to maybe slow down. Remind me during the week that we had this meeting that we're going to meet on Thursdays at 10 o'clock in the morning, right? So one thing that you can ask someone else to do that would help you, right? One person, one place, make it routine, and one ask. Pretty easy things to do that can really help with social connection if it's not something that you've been doing regularly already. That can also work for the care partner, but we've got a different mode for them. Keep one role in your life that's not care partner, right? Best friend, classmate, some other connection in your life that is part of who you are that is not care partner. Important to keep that. Name one task that you want to delegate to someone else in the next week. Schedule recovery time for you, right? It's that time away. It's the time that I need to take care of me and so that I can be the best for you. And then lastly, join in one conversation. Maybe it's with that other role that you have that doesn't talk about Parkinson's disease, right? That's such a big part of your life. Thinking about how can these conversations maybe get away from that. So takeaways. Connection is important, right? Withdrawal happens for a reason. Symptoms get worse. I withdraw more. I become lonely. Symptoms progress. Belonging goes through fit, right? Finding that group, finding your tribe can help with feeling belonging in a group and decreases loneliness. Don't forget the care partner piece, right? If you're a care partner, everything that you do is just as important as for you as what you do for your loved one. So take care of you and establish effective communication strategies. Think about things like turning off cell phones when you're at home, turning the TV off, changing the lighting, changing the sounds that are going on around you, being intentional about connecting. That's it. I know I went long. That last slide is just some references that were used to come up with those slides, but that is all I've got. Shelly, Anuba,
Yes, thank you so much, Dr. McDaniels. This was really informative and pretty excellent to me for sure. Uh, we have some people posting comments and questions, but we also have some questions that came when people registered. So I'm going to go ahead and ask some of those. And
Please.
in the meantime, people can keep chatting in the chat. Please post questions. If you want to raise your hand, that's fine too. We can take those questions that way as well. So, one of the questions that we received was about some of the most common hurdles that care partners experience when taking care of themselves as well. What are those? What are the common ones? And if you have any response to that.
Yeah, I think what I hear in conversation, I think the research talks about as well, is that feeling of guilt when I'm taking time to take care of myself, right? I need to be here, be available for my loved one, and I'm putting my health on the back burner. And it's one of the things that is rarely talked about. And I know I may have shared this on the last Mind Matters that we did. My mom has had Parkinson's for 15 years now. And up until recently, her movement disorder doc, when they go to appointments together, no one's ever asked my dad how he's doing. Right. And I get that, right? You're there for patient care, but understanding that the health and well being of the care partner is just as valuable would, it seems like to me, make sense to ask that question of, hey, how are you doing? And it's not the movement disorder doc's job to treat them, but at least they could offer something. If they're struggling, it's, hey, do you have a group? Um, have you seen your primary care if it seems like you're struggling with depression or anxiety, right? Offering a suggestion for next steps. I think that's part of it. So that's the guilt. I think depending on the stage of Parkinson's disease, I think the other component is understanding the disease and progression and symptoms of Parkinson's disease, what's normal, what's not. And so I think the educational piece, it happens over time and it's a lot, right? Those of you on here are experiencing this, I think at the beginning it can be like drinking from a fire hose, right? There's so much information out there from all of the organizations about Parkinson's disease that it's like, I don't even know where to start. This is so overwhelming. And so oftentimes when a task in our life becomes overwhelming, we retreat and we shut down rather than engaging because we don't know how to move forward. I think those are the two biggest areas that I hear and I see written about.
Actually, there is a related comment here in the chat. Somebody mentions that many of the forums for care partners are about better educating us on how to take care of our person with Parkinson's, but they need to also be focused on the health and well-being of the care partner.
Absolutely. I totally agree with that. And you know that the challenge becomes a louder voice about that because the education is important, no doubt. Understanding the disease, understanding symptoms, understanding progression, understanding what I can expect as this disease gets worse is essential for me to be an effective care partner. But I think that, and maybe it's if you're in a group of care partners that you bring that up, say, hey, why don't we have either you bring someone in or you talk about what is it that you do to maintain health? What are the practices that you engage in your life, right? And you talk about it as a group and we can learn from one another. And again, sometimes that means that you've got to be um, a little bit more assertive and say, and it could be, I talked about earlier, and maybe the group that you're going to isn't the group in your stage right now that you need to be in. Maybe the educational group was great for the first 2 years, but now you're in a place where you go, I need something different. And so it might be that the fit just isn't the same as it used to be. But absolutely, understanding caregiver health and well-being is critical.
So, some people are asking about this session being available later. I just want to mention that all of our sessions that we do on as Zoom webinar, even the ones that we do live, are all recorded and available at our website. I will type out the website address here for you all so you can go and check on the sessions. The session that we did last time with Dr. McDaniels, the first of the series, is also on there already. Um, okay. There's a question about how unique is this? And I read that a while ago, and now I don't see it here. But someone mentioned that there's definitely these unique situations that people with Parkinson's may experience. How different is it from other chronic illnesses that people may experience? So that was just a question that someone posted
Yeah,
there.
that's a really broad question. Um, that could take a whole lot of discussion. I think Parkinson's disease has some very unique aspects, right? It's very heterogeneous, which means everybody's progression can be different, right? Someone could have Parkinson's disease for 2 years and really have severe motor dysfunction. Someone else has Parkinson's disease for 15 years and has very limited. So knowing what to expect can be very difficult. I think a disease like cancer, you get diagnosed. We kind of know how things are going to progress based on the staging of the cancer. And so you can prepare for that. You can see what the next stage is going to be. I think Parkinson's is in a chronic illness perspective is a little bit more like, what you see in multiple sclerosis, where a relapse remitting multiple sclerosis, where it's better, it's worse, it's better, it's worse. It's not exactly like Parkinson's, but it's often means you don't know what it's going to look like, right? And so anytime that you have that ambiguity, I think it creates anxiety because we just don't know what tomorrow is going to bring, what next year is going to bring. Am I going to have to retire from my job? Am I going to be able to interact with my grandkids? Am I going to be able to keep the friends group that I have in 2 years? I don't know the answers to that, and no one does, right? So I think that that's one of the real struggles with Parkinson's is, you ask a movement disorder doctor, what can I expect from this disease? And the answer is going to be, well, it's a chronic degenerative disease that's going to progress over time. That's the canned response to get to that question. How fast is it going to progress? I don't know. Is it ever going to get better? No, right? We don't have that now. We don't have anything disease modifying yet. Exercise is the closest thing that we have to a disease modifying therapy. And so I think that's the challenge. But we do see it in other disease states that are just, we don't understand. ALS, we know a straight progression of ALS. You get a diagnosis and it's going to progress rapidly over the next 2, 3, 5 years. Parkinson's is a little different. So I think that creates a lot of additional burden. It's just not knowing.
Absolutely. Um, okay, we've been asked about social support groups in Dallas Fort Worth, and I know Shelley is going to respond to that. But if you have any response as well, I know DAPS, the Dallas Area Parkinson Society, has some excellent resources. But if you want to talk about that as well.
Yeah, that's DAPS would be my go-to. I think they do quite a bit of social engagement. They've continued to grow over the last 2, 3 years and offer more groups around the DFW area. But I would defer to Shelley on that. She probably has access to much more than I do. And even people who are on this webinar today, if you know of a group that's not part of DAPS or something else, pop it in the chat so other people can see it. This will be recorded. So maybe think about that. But yeah, Shelley.
There is a support group section on our website, dfwparkinsons.org. So if you go to the resource tab and navigate to support groups. There is a listing there of support groups that are available, and it's categorized by in-person versus online. And Joe, I've made a note of your information and your question, and I'm happy to personally send you some information as well. So if anyone else has any questions on that, feel free to reach out to us, info@dfwparkinsons.org, but there is a listing on our website for support groups.
Also, I want to mention that community building happens with all of our events as well, especially the live events that the Total Care Program does. We have our symposium coming up, and we are very thoughtful about making that community happen at our live events. So we have circular tables instead of people just being an audience. It's sort of make it as interactive as possible. So all of our live events, if you can attend them, please do. There's a lot of interactive element there as well. You can find friends, make friends, and build community that way as well. Okay, let's see if we have more here. I think that's really the set of questions and comments that we've had so far. I did post the Total Care Symposium agenda and schedule here for everyone as well. The third session will take place during the symposium. It will be in the afternoon, right after lunch. The symposium is free to attend, so you can register. We will have free parking for everyone, and we hope to see you all there as well. Any last thoughts, Shelley and Dr. McDaniels?
Just want to say thank you for everyone for joining and for spending time with us. Thank you, Brad, for sharing all your insights with us. We are going to be sending out a toolkit that has some of these exercises and some of the information that Brad shared so that you guys can pull from that as you need it. As you guys know, it's great to do all of these things in the session with us live, but there's going to be times when you probably need to refer back to that when you're in crisis or when you're dealing with some of the issues that Brad talked about. So we want you to have that readily available. So please refer to that and use that as needed. And always feel free to reach out to us at info@dfwparkinsons.org if there's anything that we can do to better serve you.
Great.
And
Thanks for having me.
Thank you so much. I just want to mention, because there was a last comment here about repost video and recording link, and I want to just make sure that on Monday, everyone will receive all of this information along with the toolkit that Shelley mentioned in your inboxes. So with that, thank you so much for attending, everyone. Thank you, Brad. Thank you, Shelley.
Thank you. See you next time.
Thank you.
Thank you.